I'm Judge Arthur L. Burnett, Sr., the National Executive Director of the National African American Drug Policy Coalition. The coalition was created in 2004 with the number one goal and objective was to get policy changes in America to treat the use of illegal drugs as a manifestation of a disease of addiction or dependency, and to treat it as a medical or public health problem rather than a criminal justice problem where people were subject to incarceration, release, and then reincarceration without ever obtaining treatment. So we wanted to bring a strong focus to treating it in a medical sense, just like you would treat a heart ailment, diabetes, or cholesterol problem, or any other medical problem. And when we deal with it with a medical problem, and you get a person cured in a drug treatment program, then to give the person the tool to live a stable life. If they needed GED training and education to be job ready, we would provide that for them. If they needed job training and employment and affordable housing, let's do that. It would be far less costly than people going in and out of prison time after time because they had a drug problem and no one ever treated it. So that was our number one goal. The number two goal of the organization was to bring together the black African American organizations in this country to work on behalf of reaching back to our youth and showing our youth that there is a better way to have a useful, productive life. That black Americans who achieved were not ready to jump ship and just enjoy their own wealth and largesse, but were ready to help others break the barriers of poverty and show that education could be a way to escape poverty and become a professional or career person in the technological field. So we developed a drug education and prevention program that included one of countering or preventing truancy, encouraging youngsters not to drop out of school, and to do well in school. And to do that, we offer certain incentives. That if you stay in school until you reach the 8th grade, in the 8th grade you can maintain a good B average or better. You want to become a doctor, we will give you a doctor as a counselor mentor to work with you from the 8th grade all the way through medical school as if that doctor were your father or mother. The National Medical Association and joining our coalition say, in this way, we want to double the number of black doctors in America and not lose this human talent to people getting involved in drugs and becoming prison inmates. And when the National Medical Association said it would do it, each of our other organizations in the coalition, the National Bar Association, the black social workers, the psychologists, the dentists, the pharmacists, they all said, we will do it for our profession as well. So we now have developed a national program where any African American youngster who wants to go to college in any particular field, where you could end up with a PhD degree or professional degree, we will reach out and take that kid by the hand at the 8th grade and give that kid from the 8th grade all the way through high school, all the way through college, and then into professional school, the same guidance we would give our own children. And so what the African American community is doing is saying that black America is engaged in self-determination. We're not waiting for the government. We're not waiting for white America or the business community to do it for us. We're going to reach back, those of us who have gotten the advantages of the civil rights movement, and break the problems of poverty and crime and the social ills that infect a substantial part of the black communities living in our inner cities in urban America. Treatment resources we have today can hardly address 15 or 20% of the problems we need in this country. I personally had conversations with the drug czar and the General Counsel and members of his staff about increasing tremendously the appropriations for drug treatment so that everyone who needs it can get treatment. But I've also urged, and it's a position of our organization, the National African American Drug Policy Coalition, that one should be able to get drug treatment without waiting to get criminal charges first, or be brought in court on an neglect and abuse case and have a court case, that a person ought to be able to walk into a community health center anywhere in America, just like they would if they had a heart problem or a diabetes problem or a cancer problem, and get medical public health treatment for substance abuse and get a referral. And we are just waiting for the health care reform bill to pass, because that bill promises that it will provide substance abuse treatment, access to treatment, elimination of racial and ethnic disparities for drug treatment and mental health treatment, which many times is co-occurring as to depression or anxiety or traumatic stress disorder, the same extent it would for physical ailments like diabetes, hypertension, cholesterol problems, or any other physical problem you have. And it is our position that if this is caught early on by way of prevention or in the incipient stages of the substance abuse, we can head it off in advance, and it'll be less costly to our health care system. People will live longer and be more productive, less dysfunctional, and we can indeed save money, as President Obama is suggested. But we urge that treatment on demand, where people can get it on their own, where they have the desire to turn their lives around, should be made available to the same extent we're making health care available for people for physical ailments. Our website for the National African American Drug Policy Coalition is www.naadpc, which is the acronym for the name of the organization, .org. I want to emphasize also that our coalition includes 82 historic black colleges and universities. And across America, we are involving those colleges and universities as home bases for creating local chapters of our organization in the cities and communities in which those colleges are in fact operating and have their campuses, so that we will have the joint effort of our black professionals as well as our college faculty and our students studying to go into criminal justice, social works, and social behaviors. Those students working for master's degrees and PhD degrees can reach back to our younger generation and influence them to seek quality education and be role models for them. So they don't only have to just see the pimps and the drug dealers and ride around in BMW, but they see the productive side of African American life. And we can hopefully through that over the next 10 years cut in half the number of blacks and African Americans who are going to prison and committing crimes in the country and making the crimes undermine the very viability of our national security and our workforce. And we aim to set an example and be a model for all segments of our society on how to influence our youth to become productive citizens.
Law enforcement against prohibition. These men and women have served in the trenches of the drug war as prosecutors, judges, cops, guards, and wardens. They have seen firsthand the utter futility of our policy and now work together to end drug prohibition. Please visit leap.cc.